Welcome to the NEI podcast. This is Dr. Sabrina Siegel with the Neuroscience Education Institute. Since its inception in 2000, NEI has distinguished itself from other continuing medical education companies by providing the highest quality, visually engaging, evidence-based, and fair balanced activities designed to help keep you on your A game when it comes to treating patients with psychiatric and neurologic diseases. NEI was founded by award-winning psychiatrist Dr. Stephen Stahl, who had the desire to help more patients by helping the professionals who treat them. Dr. Gary Small is a Longevity Lifestyle Geriatric psychiatrist and director of the UCLA Longevity Center. He is also a professor in Psychiatry and Behavioral Sciences. He's written many books to help patients and the public to stay mentally sharp throughout aging. Dr. Small has been named one of the world's leading innovators in science and technology by Scientific American magazine, and his research, supported by the National Institutes of Health, has made headlines in the Wall Street Journal, the New York Times, and USA Today. He's known for his ability to both entertain and teach. Let's welcome Dr. Gary Small. As most of you know, January is Mental Wellness Month. Today's episode will focus on how to preserve our mental wellness as we age. Thank you, Dr. Gary Small, for joining us today. What would you say is the underlying physiological struggle with aging?
A lot of things happen to us as we age. Our bodies get worn out to some extent. And one of the problems we see that I think affects the body and the brain that is not appreciated is that we have too much inflammation. Now, inflammation is a normal physiological process. When you sprain an ankle, it gets sore and swollen. And that tells us that our inflammatory system is repairing the damage. But with aging, we have heightened inflammation throughout the body and the brain. And it turns out that these inflammatory cells are actually attacking normal healthy cells. So we need strategies to reduce inflammation.
What do you think you can tell us in terms of the connection between exercise, brain-derived neurotrophic factor, and the role that this plays in brain health and longevity? And how does that maybe fit in with the inflammation story? Does it fit in with that, or are we talking about a different mechanism?
But exercise is anti-inflammatory. I know when I exercise and work up a sweat, I have less joint pain, and that's that anti-inflammatory process kicking in. But exercise does a lot of other things to protect our hearts and our brains as we age. You mentioned BDNF, or brain-derived neurotrophic factor. That's produced during exercise. And BDNF is almost fertilizer for the brain. It stimulates the brain cells to sprout branches. So the neurons connect and communicate more effectively. Exercise gets our hearts to pump oxygen and nutrients to our brain cells, which promotes brain health. Also, when we exercise, the size of the brain actually increases, especially areas that control thinking and memory. And we know that a bigger brain is a better brain.
What exactly is brain training, and is there scientific evidence of its effectiveness in terms of preserving brain health? Could you share a little bit with us?
So brain training can mean several things. It can be just stimulating the mind, and that's been promoted by many individuals because of studies showing that people who attend college or who are bilingual have a lower risk for developing dementia and Alzheimer's disease. But the causal relationship has not been as established as we see for the connection between exercise and brain health. Despite that, there have been a number of studies. In fact, we've studied this ourselves, showing that just searching online can be a form of brain exercise. It stimulates neural circuits and gets them to communicate more effectively. There's another form of brain training that has been tested and shown to be effective, and that's teaching people specific cognitive skills, teaching them to learn ways to compensate for age-related memory decline or to think and reason more effectively. And many studies, including our own, have shown that even after just a few weeks or a few months, these methods can be quite effective. And if people continue to use them, they can have benefits that are sustained for years.
That sounds excellent. What are some of your thoughts on the synergistic effects of combining physical and mental exercises?
Intuitively, it makes sense. If you think about it, you get on a stationary bicycle and you start pumping oxygen and nutrients to your brain. Your body produces endorphins, which lift your mood. You have greater mental clarity. So you get into this so-called zone where brain training might be more effective. And we studied this not long ago and did find that there were specific benefits to combining both physical exercise and mental exercise. So whether you do it simultaneously or sequentially, I think both these forms of training can have benefits to brain health.
So would you say the synergistic effects are better than what they would be independently?
I think it's hard to conclude that because our study was a relatively small study. But I think that people should be encouraged to train their brains and their bodies in ways that helps them. One of the biggest challenges I see is to motivate people to change their behavior. When I tell people to exercise and diet or eat right, often the response is, well, doctor, don't you just have a pill? And so we have to encourage people to get involved in programs that are not too daunting so they can continue the behaviors for the long haul. My latest book on this topic is called 2 Weeks to a Younger Brain. Now, if I called it 2 years to a younger brain, no one would buy it. But 2 weeks is enough time for people to introduce themselves to new healthy behaviors and start appreciating the immediate benefits so they're motivated to continue those behaviors for the long haul, because that's really what makes the difference, is continuing healthy behaviors, not just 2 weeks, but over years.
Hmm. What scientific discoveries would you say that you're most excited about when it comes to your research team? Can you share some novel studies with us?
So I think we've done a lot of work showing that the timing of your intervention is quite important. And I'm convinced that it's easier to protect a healthy brain than try to repair damage once it's extensive. So we've seen this repeatedly with the different approaches we've taken in interventional research. We did a study a number of years ago following up on this anti-inflammatory hypothesis and found that people who had very mild memory complaints, who were middle-aged and older, if they took an anti-inflammatory drug, after 18 months, they had better cognitive function as well as better and more efficient brain function on brain PET scan. The challenge with anti-inflammatory drugs is that they have a lot of side effects. And other studies have shown that if people have more advanced cognitive impairment, as you see in dementia, that these drugs may actually accelerate cognitive decline. So we've looked at safer approaches to reducing inflammation. And this is a reason that we've studied lifestyle strategies, healthy diet, physical exercise, stress management. And we've had some recent encouraging results with an Indian spice called curcumin, which is in curry and a lot of spicy foods. And we found that a certain bioavailable form of it had significant benefits for memory and attention over an 18-month period in people who had very mild memory complaints. So right now we're trying to replicate that in a larger sample, but I think that's an exciting approach because it's something that is safe, has few side effects, and could benefit a lot of people.
That does sound really exciting. Thank you for sharing that with us. And that actually leads me to my next question, which is how does nutrition play a role in brain health and in healthy aging?
So in many ways, I've already mentioned spice, and not just curcumin spice, but other spices reduce oxidative stress, which causes wear and tear on brain cells. In our diet, we can consume fresh fruits and vegetables, which have this antioxidant effect. Another way we can help people maintain brain health is to encourage them to avoid overweight and obesity. Midlife obesity quadruples the risk for late life dementia. Most people don't eat enough omega-3 fats, which are anti-inflammatory, and you can consume them by eating fish, nuts, or flaxseed. And it's also important to try to minimize the processed foods and refined sugars, which are not good for brain health, and in fact can lead to type 2 diabetes. And people who develop diabetes have a twofold increased risk for developing Alzheimer's.
That actually makes me think of the ketogenic diet. And would you be able to share any research findings with us in terms of what role the ketogenic diet or intermittent fasting could play in the prevention of dementia and or Alzheimer's disease?
The ketogenic diet is an effective way to help people to lose weight. Whether it helps brain health specifically, we don't know. It could be indirect in that people are dropping pounds and showing better cognitive performance. We know studies of obese people who have undergone bariatric surgery and lost weight after 3 months, they have significant memory improvements, and those benefits in memory are sustained for years. So, I think there's more that we have to study in these areas, but I have certainly an open mind to try to understand these different approaches as much as possible.
What do you think that we could learn from observing the lifestyles of centenarians?
I think the centenarians provide clues into the formula for successful aging, and we've really been discussing it: healthy diet, physical exercise, stress management, and mental stimulation. And there's also strategies that overlap with those four major areas. For example, remaining socially connected is very important and increases life expectancy and maintains brain health. And we've learned some of these factors from the so-called blue zones, places like Sardinia, Italy, Loma Linda, California, or Okinawa, Japan, where there are clusters of centenarians and they share these lifestyle behaviors. But the centenarians, again, don't prove a causal relationship. We get more into that from systematic studies where you randomize people to a control situation versus an active intervention. So if we take physical exercise, Arthur Kramer, when he was at the University of Illinois, did some compelling studies where he put middle-aged and older people on brisk walking programs and compared them to similar people, but who only did stretching and toning and didn't get the aerobic exercise. And the walkers had better cognitive performance and larger hippocampal memory centers after
Hmm.
6 months and a year.
So interesting. What could you tell us about sleep patterns changing as we age and how to get the most out of our sleep as we age?
So many people don't realize that we don't need quite as much sleep as we age. A teenager might need 8 or 9 hours. A senior may only need 6 hours. We also have lighter sleep, so there's more frequent awakenings. And often when I work with people, I try to get a detailed understanding of their actual sleep patterns, because they may complain they can't sleep, but they're going to bed at 9 p.m. and they get up at 4 a.m. That may be enough sleep for them, and they may need to shift their sleep cycle to help themselves. I like to try to help people sleep without sedative medications, because they can have side effects that affect memory. And we'll teach them guided meditation, teach them sleep hygiene techniques where they get some exercise during the day, don't drink a lot of liquids in the evening, and use similar approaches to help them get a restful sleep.
That sounds great. You've been known to say that the only cure for Alzheimer's disease is prevention. Can you tell us more about the Alzheimer's prevention program that you've created?
So that program was another book that I wrote. All my books I've written with my wife, Gigi Borgen. She makes me sound smart because she's quite a good writer. And the idea there is compelling evidence that these lifestyle strategies can delay the onset of Alzheimer's symptoms. So, if we can delay it long enough during a person's lifetime, that could be equivalent to a cure if someone dies from some other cause. And, the evidence is really quite compelling that these modifiable risk factors have an impact, not just for the individual, but for public health. And some estimates have it that they account for 50% of Alzheimer's cases worldwide. If we could delay the onset of symptoms by 5 years, we would have a 50% reduction in cases of Alzheimer's disease, which would have a huge impact.
I'm actually really excited about so many of your books. They look wonderful. And for those of you who are interested, you can go to drgarysmall.com/books/. So it's DRGARYSMALL.com/books. Would you be willing to share with us a little bit more about some of these other books that you've written or co-written that could help maintain brain health and wellness?
So there's a book that hasn't come out yet. It's going to come out in a month or so, called The Small Guide to Anxiety. And there we talk about anxiety disorders, which are very common and can impair mind health. We have another book that is called The Other Side of the Couch, which discusses my most unusual cases as a psychiatrist throughout my career. And there, people will learn about other mental issues that affect people, and it draws the reader in because of the medical mysteries that I encountered throughout my career, and it really helps people understand these different kinds of problems. And each of the books addresses another area of mind health to try to help people live better and longer, which is the tagline of the UCLA Longevity Center, which is a center here at UCLA that I direct.
Excellent. Well, I just want to thank you so much for joining us today, Dr. Small, and thank you for sharing so many great tips with us about brain health and wellness.
My pleasure. And remember, it's easier to protect a healthy brain than try to fix things once they become extensive. So the sooner you get started, the sooner you benefit from this kind of a healthy brain lifestyle.
Absolutely. Thank you. This episode has been brought to you by the NEI Prescribe app. The most powerful tool for your prescribing arsenal is here. Based on the best-selling prescriber's guide, NEI Prescribe app gives you access to full prescribing details, including expert tips and pearls, more than 140 psychiatric drugs, and with the unique filter feature, you can identify treatment concerns specific to each patient in order to generate a customized list of possible medications to review. With full prescribing details for more than 140 psychiatric drugs, the NEI Prescribe app could help you in your practice. Go to www.neiglobal.com.